Hi, Dr. Ahadian. Continuing with the issue of loss and uh, the experience of that, there is an important matter to be discussed, and that is the relation of the losses that a person would suffer at a specific developmental age and the expression of different disorders. Basically, in the developmental stages of a human being, we go through a oral phase, anal phase, and Oedipal phase. And then the maturity and the growth of that, which basically the most important part of this developmental stage goes through birth to 5 years old. Through birth to 2 years old, basically the child goes through a phase which is called oral phase. Oral phase is a phase of developmental stage where all the information, all the communication, all the sensations, basically theoretically is being told that is focused on the orality and with food. Basically, when the child is hungry, goes through a rageful anger, frustrated mode, and then crying, and then getting food, and then calming down. So then this stage is a very critical stage, because if there is any loss happening in this stage, there could be a fixation of the human being on expression of emotions in this stage, which basically goes through expression of severe mental disorders with schizophrenia, with related issues, with severe explosive, severe psychotic rage stages. There are issues related to eating disorder that could express because of the relative phase of developmental stage in the fixation on the oral stage, with anorexia, with bulimia, and expressive pathology related to this stage is very important with regard to object relationships, which could express itself by the devouring and then expulsion, and so to speak, like eating and throwing up the object with either black or white, kind of like a spectrum, which exhibits itself with the expression of the problems related to the fixation in the oral stage. Now, any kind of loss that could happen in the oral stage, we're not talking about death or dying. We could talk about being left alone, the child being left alone for more than periods that the child could tolerate the loss of the object, which is mother, father, caretaker. And this loss at this early stage could have a tremendous effect on the emotional well-being and the build-up of a personality of an individual being throughout his life or her life. And therefore the losses in this stage are extremely serious and should be seen as related issues with severe mental disorder.